Hello everyone. We are discussing various X-rays under the topic reflection. So how the various anatomical landmarks reflects on the X-ray we are discussing. So this is Professor Dr. Prashant Bhusari. Welcome you on this emerging MEDTALK. Discussion is on 10 views of the chest X-ray. Very most common is the posterior anterior view. Routinely we are doing that is 90 to 95%, then the anterior posterior, then lateral and other views. So first view is the posterior anterior view. So it is the standard frontal projection and it is taken in the full inspiration, and the X-ray it passes from posterior to anterior side, and the film cassette is placed on the in front of the patient. So this is PA view. So we can see here this is X-ray tube and how this X-ray passes from this posterior to anterior side, and this cassette is placed in front of the patient. So this is posterior anterior view, where we can say obliquely place these clavicles, obliquely place ribs, and also the proper size of the heart we can measure, and also we can see these scapulae placed out of most of the part out of the field. So very this common, this is a posterior anterior view. Then anterior posterior view, where the beam or the X-ray passes from anterior to posterior side, where the intubated sick patient particularly standing is difficult. So in that condition, anterior posterior view, we can see here this is X-ray tube and how this X-ray passes from anterior to posterior side, and cassette is placed behind the patient. So here we can see transversely straight clavicles, then transversely horizontal running these ribs also. Then there is a magnified appearance of the mediastinum, that is heart, and also we can see here particularly the bronchiovascular markings equally distributed on this whole of the lung parenchyma. So next, after this anterior posterior, is this third is lateral view, where the particularly we can see the retrosternal retrocardiac areas not seen clearly on PA and AP view, can be seen clearly on these we can see lateral view. So here we can see. So this is the chest X-ray lateral view. Then next will be the lateral decubitus. Very small amount of pleural fluid, pleural effusion can't be seen on this PA, AP or lateral view. So the patient we can see is lying either in left lateral or the right lateral, and very small amount of fluid can be measured in lateral decubitus condition. Then expiratory film, particularly important for the suspected pneumothorax, or we can say the ear trapping due to inhaled foreign bodies. So this is expiratory film. Then lordotic, particularly the area behind the clavicles not seen clearly in the posterior anterior view. So special view for that is lordotic view we can see, and the particular lung apices behind the clavicles can be visualized clearly. Then right or left anterior oblique, for most of the oblique positions, and most of the we can see the ribs can be visualized here, and there may be a posterior oblique also. Typical ribs view, where the most or the part of the ribs we can see throughout its extent, and here particular fractures or some bony pathology can be detected in this view. And then next, sternum lateral view and the sternum oblique view, where the pathology related to sternum, either related to the fractures or the these bony tumors, can be detected in these views. So these are the very simple 10 views of the chest X-ray. Most common is posterior anterior view. So this is all about the today's discussion. So we have various videos related to this reflection X-ray series. So you can subscribe for further videos. If any suggestions, you can add in the comment. So this is today's discussion. Thank you.